Welcome back. Top Biden administration officials are reportedly weighing new mask mandates, especially indoors, for areas with low vaccination rates. 4 sources with direct knowledge of the matter tell Politico the topic was discussed during a meeting with White House and health agency officials on Sunday. But those mandates, if they get reimposed, won't come without a fight. In Missouri, the state's attorney general is now suing the city of St. Louis to stop a mask mandate there. Last week, St. Louis implemented an order requiring masks be worn indoors and on public transportation by all individuals over the age of 5, regardless of vaccination status. Yesterday, Missouri's Republican Attorney General Eric Schmitt filed a lawsuit against the city, calling the mandate unacceptable and unconstitutional. And in Tennessee, a pastor is threatening to turn away mask wearers from his church. According to the Charlotte Observer, Pastor Greg Locke confronted his Nashville area congregation during a service at the Global Vision Bible Church on Sunday. He said, quote, "If they go through round 2 and you start showing up with all these masks and all this nonsense, I will ask you to leave." The pastor added, quote, "I'm not playing these Democrat games up in this church." His reported comments come as Nashville saw its 3rd day of an 8% or higher positivity rate among the unvaccinated. My God.
So you have actually pastors who claim to be preaching the gospel of Jesus Christ, saying that he's going to turn away people that want to hear the word because they're wearing a mask.
Yeah.
Because they believe it's in their best interest, in the best interest of their children. Maybe they have a diabetic in the house. Maybe they have someone with other underlying symptoms. And so they're going to wear that mask to protect their children. And you actually have a pastor that says he's going to leave and not going to preach the word of God to people who are trying to protect themselves and their families because they wear a mask.
I'm just wondering where he gets his information.
Well, it's not from the Bible. It's not from the New Testament. It's not from the Gospels. Mm-hmm. I think actually he should just leave, right? I mean, maybe they're more interested in politics than they are in faith. Maybe they're more interested in the teachings of Donald Trump than the teachings of Jesus Christ. But that's one of the most un-Christ-like things.
Joining us now
that I've heard about this vaccine coming from an evangelical preacher's mouth. It's unbelievable.
Executive Dean of the College of Medicine at the University of Tennessee Health Science Center in Memphis, Dr. Scott Strom. Dr. Strom, thank you for being with us. As states in the Mid-South have among the lowest vaccination rates in the country, you say you never imagined life-saving COVID-19 vaccines would become a divisive political issue. And yet here we are. How did it happen? What are you hearing?
Well, thanks so much for having me. Vaccines are a staple of public health, and that's where we need to go. That's really the way that we are going to get out of this pandemic, particularly with the new Delta variant affecting us so deeply. So it's just so unfortunate that vaccines have been politicized. They're not political. They're simply a life-saving measure, which I would encourage all Americans, independent of your party, independent of your ideological beliefs, to get, not just for yourselves, but for your neighbors and for those folks, maybe for whatever reason, who are immunocompromised and can't get the vaccine.
So, doctor, help me out here. I've got my son and daughter-in-law live in Nashville, and when they were visiting, they said, "Did you hear about the state of Tennessee?" I said, "No, what?" They said, "Oh, the state of Tennessee's they've decided that they're not going to send out information like they usually do about vaccines." I said, "You mean COVID?" They said, "No, all vaccines." I was shocked by it. They said, "No, this sounds like Facebook disinformation." I looked it up and saw that they did initially do that. Can you explain what they did, and I guess they backed down and now are going back to that. But how disturbing is that to you that actually state officials decided that they were not only going to work against education on COVID vaccines, but also the vaccines that you and I and tens of millions, hundreds of millions of people have had to get into schools over the past 50, 60 years?
Yeah, I think, from my perspective, obviously, we want everyone to be vaccinated. The way Tennessee works is a little bit different in the sense that Shelby County, where I live, has an independent health department, so that didn't affect Shelby County. And what I can say is that I think the state has largely reversed course, and I think that's very appropriate. And I'm very glad they did it because, look, right now in Shelby County, our R0 rate is the highest it's ever been throughout the pandemic. We have, of the eligible people who could be vaccinated, only 51% have received their first dose, and about 42% have received both of their doses. We anticipate in the next 2 weeks that we're going to have over 500 cases a day, and we anticipate that we'll have about 500 people in the hospitals and about 140 people in the ICUs. And these are younger people. These are folks who are not vaccinated. And the challenge is they're getting sick and they're dying of this disease. We had 17 folks in Shelby County die of this disease last week. This does not have to happen. It simply does not have to happen. And it's just so very sad to me as a physician when there are life-saving preventive measures out there and we don't use them. It would be like being thirsty and not drinking. That's where we are right now. And our job as doctors is to explain as well as we possibly can why folks need to get the vaccine, that it's safe, that these common myths that we see on TV, that they cause infertility, that those are flatly just not true. And they have to debunk those myths so that folks feel comfortable getting the vaccine to protect themselves, their families, and everyone else.
Dr. Scott Strom, thank you so much. He is Executive Dean of the College of Medicine at the University of Tennessee Health Science Center in Memphis. We appreciate your words this morning.